It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with our new co-host. This is Candace Kruger, former Miss USA. And Candace, we'd like to welcome you to the program.
Well, thanks for having me. I'm super excited to be here.
And I tell you what, your very first show, we're going to let you do the honors and introduce the first doctor.
That's right. We have one of the best radiologists in the Houston area, Dr. Stephen Rose.
I saw the potential in 3D, it really taking digital to where we needed it to be, and it really has become what I would call a revolution. And I was very strong in my recommendations to the company that we really focus on looking at this as a screening tool. That's where it was going to make its impact.
2 years ago, I went for my annual mammogram and was in there, and they told me that they were doing a study for the 3D, and they asked me if I'd like to participate, and I said sure. I was already back there and undressed, and it was not a big deal.
She was the second patient in the multi-center trial that we did in 2010, and you had to come and get your standard 2D digital mammogram, which got read separately, interpreted by a different radiologist, and then the 3D exam would be performed separately.
First, I got the letter that said that no problem, didn't see anything, come back next year. Then I got the phone call and they said, well, no, we saw something in the 3D. And it turned out that one of the tumors was actually an aggressive, the HER2 had a HER2 marker in it, which is the more aggressive, can be one of the more aggressive cancers.
As we're able to page through the breast a millimeter at a time, we're able to look at areas that we would struggle with before on the 2D mammogram and say, is that something or not something? If you find malignancies less than 10 millimeters in size, the prognosis for the patient is essentially the same as the general population. So most of those people, the vast majority of those people, 98%, are cured.
Obviously somebody up there was looking out for me. I mean, I think it's the greatest thing. I mean, I think it saved my life.
So this woman had received a normal letter for her regular digital mammogram, but on 3D, we were able to find two very tiny cancers. That's the value of finding it at this stage, and that's what makes this test the most exciting thing I've seen in my professional career.
When you talk about Ceci, she's talking about issues that pretty much any lady who has had several children will talk about, that they just feel that their stomach never quite went back to the way it was before.
I've been active all my life, and in sports throughout high school, my collegiate years, ran track and field and competed in Miss Fitness USA competitions and had a flat stomach for pretty much most of my life. I had 3 beautiful girls, but with the pregnancies, I had 3 C-sections also. And so having the flat stomach before and not able to achieve that afterward was kind of like, a punch in the stomach, so to speak. And I wanted to do something about it.
And you can do all the exercise in the world, you can diet all you want, and you will still find ladies that still say, I just bulge a little bit more than I remember. And why do they? It's because that tissue, that connective tissue there of the stomach, has basically been kind of stretched out like a balloon that's been overinflated, a rubber band that's been pulled too far, and it never will snap back to the way it was before.
I need to start, doing for me now, just getting my body back to the way I wanted it to be, and I really didn't think of plastic surgery, but I did my research and I'm glad I did. I'm just so happy that I did.
You see all the effort you're putting in, you want to see the results, and That's frustrating for any individual to do something and not see the results from it, and that's where she was. But then after the surgery, I mean, once you get that tightness back and fix the tissues that were stretched out by pregnancy, then it just adds that, you know, whole measure back to her exercise that, you know, she wanted to have from before.
The flat stomach, it is there. We've gone on 2 cruises already, and I've been in my bikini. I haven't been able to do that in a long time, since before my competition, so that was back in 1999, so I hadn't been able to do that in a while. I'm full force working out, doing ab exercises, working out with my husband, and running, jogging, just doing all the things that I used to do, but now I can show it off and I can wear a half tank top, you know, to work out in, you know? It's like things I didn't think I would be able to do again, thanks to Dr. Bancroft, yeah.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to bestdocsnetwork.com.
People go for snoring, but they need to figure out if they're treating snoring, if they're treating a real medical problem, like sleep apnea, so that they treat the cause of their snoring instead of the noise.
Dr. Ludwick's in-house state-of-the-art sleep lab allows him the opportunity to evaluate his patients in a comfortable setting.
Well, people don't come see me for a test, okay? They come see me because they feel a certain way, and they don't want to feel that way anymore, or they don't want to have this symptom like snoring anymore. Testing is a means to an end. It's a means to understand what is going on with you so that I know how to treat you, okay? So we have to have the test to know if I'm treating someone who just makes a noise or someone who actually has a medical condition that causes heart attacks and strokes, and as you saw in the nightly news, if you watch the nightly news, increased chance of cancer now. So it's a real medical problem. So I do the testing. The testing is necessary for the treatment, okay? Once we decide that you need treatment, let's say for sleep apnea, then we got to figure out how we're going to treat you. There's lots of different treatment options. There's surgical ways to treat sleep apnea. There's non-surgical ways, and it just depends on the person, their anatomy, and their overall health status. Which way that we want to help them. And the good thing about coming to an ENT that does sleep is that sleep apnea is an upper airway problem. It's not a lung problem. Okay, you don't have a lung problem. You have a can't get the air to your lung problem. Yeah, and so that's why it's good to go to an ENT, because then we can address all the anatomic issues you may be having, because these guys have other things like deviated septums or big turbinates or big tonsils or huge palates, big tongues, things that we can help surgically manipulate those structures so that they're not causing obstruction, or if they are causing obstruction, cause less obstruction. And that's the benefit. And also use these other non-surgical techniques like CPAP or oral appliances or things like that.
From initial testing and evaluation to a successful treatment plan, Dr. Ludwick provides his patients with a one-stop solution.
That's the purpose of us building a relationship. It's not something we fix in one visit, it's a journey, and we're gonna evaluate you, find out what the problem is, pick some options, and let's see how you do, and then we can always change the plan. It's not written in stone.
We are hearing a lot about the West Nile virus infection now, and there is a lot of that out there now, but for most people it's not a big problem, so you don't need to panic. West Nile virus is like any other virus. It'll cause you to feel tired, feverish. Your fevers may even be as high as 102, 103, 104. You'll be achy and just generally feel bad all over. Now, again, in most people it just goes away on its own. The people that it's mostly risky for are those who are over age 50 and those whose immune systems are not up to par. For example, people with diabetes, people on chemotherapy, older and frail people, or people with multiple diseases. So if you're in that category, you need to be real careful about seeing your physician if you feel ill. Normally we tell people to take Tylenol and call me in the morning, or take Tylenol and give it 2 or 3 days. If you have an immune system that's not working very well and you have high fever during this West Nile season, well, you probably should be seen on day 1 of your fever, not day 3.
A bunion informity is a deviation of the first metatarsal and the second metatarsal. So basically, what people see of their big toe is this. So the big toe is pointing this way, and this bone is going out this way. When it's not matching up well, you get bone growth. And so bone starts to build up right here, and it also starts to build up top.
I spend about 85% of my time traveling, so I'm in and out of the airports. As a training manager, I do a lot of facilitation, so I'm on my feet a lot walking, and it got to the point where even flat shoes, what most people would think is comfortable shoes, became painful.
Her surgery was an ostium bunionectomy, but it was a little bit different because on the x-ray I discovered that she had severely arthritic joint. She had fracture fragments. So these fracture fragments never healed. And because they were constantly moving, it was severe pain. It caused an enormous amount of bone growth on the top and on the side. So I was really excited to do her surgery because I knew it would provide immediate relief.
I'll be wearing the boot for at least another 4 weeks, and then I'll come back for another reassessment. And then he'll determine then whether I can take the boot off and then just start walking in normal shoes.
People always ask, why do I have this problem? And the biggest component is genetics. So if you look at your parents' feet or your grandparents' feet, it's basically telling you, if you see a bunion deformity, that your chances are your feet are going to develop these structural deformities. Then obviously for the females, it's wearing the high heels. There's a price to pay for high fashion. You wear the high heel, it puts your foot in position, which predisposes you to a bunion deformity.
Well, I would love to be able to get back out there and be pain-free. A lot of times I couldn't wait for the day to end because I would be in so much pain. So I'm looking forward to being able to be on my feet for longer period of times pain-free.
The look on the patient's face when they come in and they see the results and they're happy with the results, and they see that instead of having a crooked toe, or that it's actually straight, and that the pain that they had before is gone. So, that's the rewarding part to me.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in two settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a three-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
For more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com.
That is the place to go. Right now, it's time to head to our next best doctor. That is bariatric surgeon, Dr. Robert Marvin.
I had the gastric sleeve. It's where they go in and they remove about 2/3 of your stomach, and it didn't involve any rerouting of the intestines, which is what I really liked about it, so I didn't have malabsorption problems. Went in one day, did it, stayed that night, went home the next day.
The difference with the sleeve compared to the gastric bypass is that there's no malabsorptive component to the surgery. So it avoids some of the long-term issues that can happen with the gastric bypass. In particular, there are very few vitamin and mineral deficiencies later because everything goes down the normal way. A lot of patients feel comfortable with it. They know that there's not something that probably may have to be taken out later on. The weight loss is very good. It's comparable in our patients to a gastric bypass, probably within 5% to 10% weight loss compared to the gastric bypass, which is the gold standard.
Last month we went on vacation. We were gone for 12 days up to the East Coast area. We walked through the Arlington National Cemetery, which I wouldn't have been able to do a year ago.
The operation, we like to say, is not an end in itself. It doesn't take care of everything. It won't lose weight completely on its own. But what the operation does do is it gives the patient a lot more control than they have before the operation. If you do the things that you've been trying to do to lose weight, if you exercise fairly regularly and consistently, even if it's not a lot, you will lose a lot of weight. If you eat right, if you decrease the percentage of carbohydrates and fats in your diet and increase the percentage of proteins and limit the total number of calories, you will lose a lot of weight. It makes the good behavior a lot more successful than it was before the surgery.
First of all, it's a tool. It's not a fix. Dr. Marvin and his staff will get you there. They will walk you through it. Make sure that you are taken care of, that your needs are met too. And that's what's so great about Dr. Marvin and his staff. It has made a tremendous difference in my life.
Well, from the standpoint of non-invasive treatments to the face, such as the Botox, that helps reduce the wrinkles. So you want to prevent them before they actually establish them themselves long term. So that's what the Botox is going to do. It's going to paralyze those muscles that cause the wrinkles. Therefore, you don't get the wrinkles.
Botox is more for like the fine lines that I have around my eyes or my forehead, or especially, you know, in the zone where we make the little snooty face. And over time, you know, the creases get worse.
In addition, anybody who has the aging process, which is the natural creases or folds in their face, that's where the filler can come in.
The filler I come in for my lips, just to soften the area right here where it starts to wrinkle. That didn't happen until after my mid-30s. I started getting a little fine lines around my lips. So she came in, it's really not to have big lips, it's just to soften this area. And in my folds right here.
There are different types of fillers on the market now. The most common is a hyaluronic acid type filler, which means it is a protein that's normally found inside the skin. And by injecting this type of filler, it attracts water to the area and therefore plumps the area out.
If I get a Botox procedure, I can come in on my lunch break. It's very quick. I can go back to work. I don't look crazy or weird.
Anybody can be a good candidate for Botox and fillers as long as they're not on any blood thinners, okay? Or if they have any allergies to any specific medications, such as the Botox or the fillers.
I believe the non-invasive route is the better route. And then if that doesn't help, then you may have to have some type of plastic surgery done. But there's all kind of things that you can do now between the lasers and the chemical pills and really good products and injectables. I believe that you can do a lot and you don't have to so far go as far as getting cut on. Mine is to really look refreshed and, you know, nice. I'm not trying to look 20, I just want to age gracefully.
We finished the barbecue and I was cleaning the barbecue on the backyard. My wife and my son were inside the house. By accident, I guess I hit with my arm a very big leaf from a plant that we have in the backyard. And I didn't notice that there was a wasp nest on the other side of this big leaf. And then 3 wasps came from the other side and came right on me. And I remember having seen 2 wasps coming right like airplanes into my face, and I was looking at them, but then there was another one that hit me on my left arm. and that was it. I mean, within 10 minutes, basically I was all swollen up.
His biggest mistake when he was taken to the emergency room was that he stood up. If you're allergic to the bee or the wasp or the hornet, it will cause a release of histamine into the system and other things that cause you to break out, swell up, and lose your blood pressure. And it's the losing of the blood pressure that's the most life-threatening.
My wife tells me that I was totally like no strength in the muscles. Everything was like drooping. That's what she says. Everything. I just lost complete control of everything, of every motion.
Typically, we'll keep people on the allergy shots for a minimum of 5 years, and then we'll reevaluate where they are in terms of the usual blood test is what we follow.
The most important thing to me was that she explained to me, she made me understand what's happening. And I think that all the knowledge, all the understanding of what happened to me, and that this thing can be improved, basically, in terms of my case, you know, with therapy.
It's possible for a person, even if they're on the allergy shots, to have a reaction, so we don't want them to get too sure. And until you're really built up to your maximum dose and you're coming once a month, we don't really know what's going to happen. Hopefully you're not getting stung, but we always want them to be prepared for if there's multiple stings or if by some chance it didn't work as well.
You know, I like to understand things, and I think that having the knowledge of what happened and the treatment, and there is a process, definitely has given me and my family a tremendous peace of mind.
Cynthia wanted to lose body fat in certain areas to get ready for her big wedding date, and she did that with the help of Dr. Lucian Rivela. To find out more about Cynthia's story and other life-changing stories, log on to bestdocsnetwork.com.
My name is Rashid Rashid. I have an MD and a PhD. I was born and raised in Puerto Rico, went on to medical school at Loyola University. I did a combined degree program. I did an MD and a PhD at the same time. So it took me 7 years. Normally, if I had done them separately, it would have been a 10-year program. I've always had a very strong interest in research. I really like to understand where the information we use comes from, why we use the information we use, and why things are happening. I trained at MD Anderson, so when I did my training there, I had the opportunity to do rotations in clinics around the country, including at UCSF and other clinics that specialize in hair loss. So it always fascinated me to be in this area where few people were in, and where it really matters to people. It really matters to people that they're losing their hair. And yeah, we have over almost 70 peer-reviewed papers, all in journals that have very strict criteria for publications, including national journals like academy journals and our specialties in dermatology and medicine, trauma, across the board. Our hair loss papers mostly focused on things like other peripheral associations with hair loss, like vitamin D deficiency. We have a paper that is often cited about vitamin D deficiency and hair loss. We do a regular daily auditing of the peer-reviewed research, and we regularly review and examine what's out there. We consolidate that, we provide that in an updated blog we have online, and it basically summarizes all the main new research ideas that are coming into place or they're just being developed by scientists and physicians around the world. So our method is called the follicular unit extraction. That's been around for a few years. It used to be done manually, hair by hair. It would take a long time. Now we have different devices and machines that have sped up the process, so we can do larger cases in less time, and the price is also more acceptable to people than it used to be. You would get more hairs, get back to work, and a lot less downtime. And the healing is very, very quick.
I was diagnosed with fibromyalgia 5 years ago, and I was experiencing chronic pain, exhaustion that wouldn't go away. I actually met Dr. Beck through his wife. Somehow the conversation that I had my fibromyalgia came up, and she said, my husband is doing a new study. It's called a P-stem. And I was like, and she explained that it was for chronic pain, arthritis, fibromyalgia. It was FDA approved.
What is nice about P-stem for patients is that there is very little pre-radiation prerequisites required to place this on. Outside of the contraindications of pregnancy or pacemaker, any candidate can benefit from P-stim.
He installed it right there, and there was no drugs. I drove myself there, I drove myself home. Within 4 minutes of him putting it on, my headache started decreasing and my pain started to ease up. And by that evening, I just felt great. And somebody said, "You just look happy." And I was like, well, I'm not suffering from that chronic fatigue and that chronic pain.
There is a lot of skepticism initially with using P-stim, but I've read the articles, I read the journals, I spoke to patients, and I came to realize that this actually will be beneficial to patients. So I took the initiative to talk to the distributor and made plans to be trained in the use, and that's how I became the first physician in Dallas to be licensed to use this device.
And my husband's gotten his wife back. My children have gotten their mom back. I don't complain. I'm happy. I feel great. And I'm really excited about it.
What I find rewarding about P-stim is that I can finally offer patients a non-pharmacologic way to help patients manage their chronic pain.
Well, I'm an ultra runner, and my skin, as I've aged, has gotten extremely thin. My fat level's very, very light because I'm an ultra runner, so I spend about 70 miles a week running. And I was getting wrinkles all around my face.
Pam is actually my nurse anesthetist who's been working with me for a number of years and has had an opportunity to see work which I've done on other patients. She had some redundancy of skin in her jowl and lower neck and cheek area, and she's very thin but has lost elasticity in her face.
I talked to him, and then I waited about a year and tried to think if this was something I wanted to do or if it was something that I could live without doing. And because I run 100-mile marathons, I honestly don't feel 56. So when I would look in the mirror, I could see a lot of my face just almost falling off. The skin was just so thin.
We're actually providing fat and transferring it from one area of the body to another, not just as a filler, but as a method to rejuvenate her face. And we're doing this with a transfer of fat with stem cells. And so this is a kind of a new technique which we're using now for individuals like Pam.
Totally happy and satisfied. I am very grateful. If you pull out a picture of me back when I was in college, it just looks like I'm an older sister, and I love that. You know, I don't want to look like I'm in my 20s and 30s, but looking like I'm in my 40s, that's okay.
Patients come in, they basically want to look as good as they feel. They sometimes will ask, am I too young to have this done, or am I too old to have this done? And basically it doesn't matter. Basically, if they are physiologically fit and psychologically appropriate, then they're good candidates for surgery. But it has nothing to do with your chronologic age, clearly.
It's been wonderful, but the best thing about that is I feel good about myself. You know, I take a lot of time in maintaining my health, and I feel young. And now I just feel like I look young.
All right, that'll wrap up another edition of the Best Docs Network. And for our new co-host, Candace Kruger, that was pretty much pain-free, wasn't it?
It was a lot of fun, too.
Well, great job. And I tell you what, for all the folks out there in the Houston area, we'd like to once again welcome Candace. And for all the folks out there in the Houston area, don't forget, for more information on any of the doctors you've seen on today's program, head to the website, bestdocsnetwork.com.
That's right, and if you have a question or comment from us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
There you go. So long, everyone. We'll see you next week.